Hey community, this is Dr. 𝗬𝗍𝗶𝘃𝗀𝗃, and today I have a new webinar, and this is all on cardiovascular health. Do you have a leaky cardiovascular system? Just like a leaky brain, just like a leaky gut, you could have leaky endothelium. So I found a lot of people that have a lot of chronic condition have some kind of component of a vascular component that's affecting them on why they're not getting better. So when we talk about you getting better, if you have a chronic condition, we need to do a polytherapy approach, and we don't want to leave anything out that could be a possibility of you not getting better. Just like we would never leave out a leaky gut. We don't want to leave out a leaky arterial system, or more technical, a leaky endothelial system. So what we're going through today is what I call the brain scan, or not the brain scan, the heart scan. So you can get these heart scans done for basically 99 bucks here. I'll walk you through the process, what needs to be done. So what I've seen clinically now is people that will have low blood pressure. This is a classic sign of people that have low blood pressure, meaning that they don't have good cardiovascular system, meaning that they could have possibly leaky endothelial cells. If you have poor blood pressure, if your glucose is off, if the heat difference from basically your knee to your foot is off, this can indicate that you have poor cardiovascular system. So what I'll be walking you through is this heart scan, or what they call here is this a calcium coronary screening, or basically simplified a heart test. So what we're checking for here is a coronary calcium scan. So the arteries in your heart are called coronary arteries, all right? So you have coronary arteries in the heart. And what this scan does, it's a CT scan. It puts basically x-ray through your heart. It takes 7 pictures of your heart to see if any of your arteries are calcified in your heart. Now, why is this so significant? Is if you have calcification in your arteries in your heart, you probably have calcification to some degree in your legs, in your brain, in your hands, and this can be affecting why you're not getting better. And the truth of the matter is, you can go to your local center, wherever you live, and ask for one of these coronary calcium heart scans. So you would go to a place that does CT scans, MRI scans. They're all over here. I'm in Minnesota. I'm in Minneapolis. They have probably 20 different places that I could go and get a heart scan or a calcium coronary scan done for literally 99 bucks. Insurance doesn't cover it. Insurance doesn't cover it. Go and pay cash for $99. So what this does is it's literally 10 minutes. They put you in a CT scan, and then they basically are going to be looking at the arteries around your heart. So how does this actually work? How does this technology work? So let me show you here. So here we have the heart, right? And then you can see this would be where the x-ray is going to go in your heart. Now, the score is from 0 all the way up to 1200. So here, this would be your heart, and this would be a score of 0, a score of 30, a score of 300, and then a score of basically 1,000. So you can see initially here, there is no calcification in the arteries. So what we're checking for is calcification in the arteries, not like in the muscle tissue, but in the arteries right here. So here's a score of 30. You can see a little bit of calcification. Here's a score of 300. You see more calcification. And then here's a score of 1,000. You can see a lot of calcification starting to form in this person's chest right here. So this is what's happening. You see, this is the chest right here. This is the heart right here. Now, what you're looking at here is the heart. And then you see these arteries coming right here. So you can see these different arteries. And then what I've done in this picture right here, I've changed the heart position. So you're kind of looking at your heart from this angle. So this would be the beam that would be coming right here. And when you see that, is what they do is they put these x-rays, they do 7 different x-rays through your heart. So for example, right here, so 1, 2, 3, 4, 5, 6, 7. And you can see here is when you do these 7 scans right here, if there's any calcium in these arteries, this is going to show up. It's going to be a positive calcium coronary score on your scan. Okay, so here now what we're looking at is, again, you can see this would be the scan of the heart kind of at an angle. And then here you can see right here, this is the calcification of the arteries around the heart. Now in here we have a coronary calcium score. It's just CAC of 0. You see that there's no calcification in that heart. And then here we have a CAC of 1200, which is super, super high. You can see how much calcification is all around in these different arteries. So this is a really bad situation that's happening. Here's a really another great visual I like to see. You can see all these different calcium deposits right in here. So the coronary calcium score. Now, what the heck does all this mean? Like, what do these numbers mean and that thing? So 0 is no identifiable calcium deposits. We have score of 1 to 10, a score of 11 to 99, 100 to 399, and 400 to 1,000, and 1,000 up. So this kind of gives you an idea of what this all means in here and what the scans mean and what the scores mean. And I really like this next picture right in here. Let me minimize me here so you can see what's happening. So you can see the score in here this would be a score of 0, and then basically these scores right in here are pretty much 0 scores, okay? So it's a non-calcified soft plaque tissue that's starting to develop. So we can have these soft tissues developing, its plaques developing, and not have calcium yet. This is when you start to go from 0, anything above 0 would tell you that that is forming calcification. You can see this calcification forming right here, and then this big, huge calcification right in there. Now, this is literally in the arteries of your heart right here. So if I move this here, you can see this score right here. This score right here is above 100. This is from like 1 to 100 right in here. So this is very, very specific technology on what's happening in your heart. Now, what I like about this graph right here is I find this very, very interesting. So you can see the scores right here, 0 to 400. Now, guess what this is saying? No treatment. 1 to 10, lifestyle changes. 11 to 100, lifestyle changes. 100 to 400, lifestyle changes. So most of the stuff is lifestyle changes. So this kind of gives you a baseline of what's happening with your heart and how your cardiovascular system is and what kind of condition it's in. Now check this out. This is one of my clients. This is a coronary calcium score. Now look at this. This is absolutely insane. What's the score right here? 1,206. 1,206. Normal's less than 0. You want 0, right? So this is a really, really high score. Had no problems, no clue that this was actually happening in his body. All right, so this next is actually my scan. I'm going to show you my scan right in here. You can see me. This is my name up in here. Now, what they're checking here is what I like about my printout right here is this is the different arteries. They're checking 4 different arteries in your heart. The left main coronary artery, the left anterior descending coronary artery, the circumflex coronary artery, and then the right and posterior descending coronary artery. They're actually checking 5 arteries in your hand, in your heart with a scan. Literally, you're out in 10 minutes. Okay, so if you can see these arteries right here, you can see how they would slice it and how they go through these different arteries right here. So the 7 slices. So you can see here how they get all these in front. There's a couple in front, there's a couple on the sides, and then there's a couple in the back. So you can see how powerful this test is and how they're checking all those different arteries. Okay, so this is my scan. So it's not crazy, right? But I have a baseline. This is 0, 0, 0, and then right here we have 0.3. So, I have some calcification. There is actually a calcium deposit sitting in my heart. So what does this tell me? It tells me, I need a baseline. So now what happens if I'm going to get this scan in another 2 years and it's bigger? Well, then I need to get more lifestyle changes. I need to get my lifestyle even cleaner than what it is. So this is a baseline to determine what's happening in your body and in your heart. Now, these are some research articles on this. I just think they're good research articles. So coronary artery calcium score, is it a predictor of cardiovascular and stroke? And it actually turns out that it actually is. So here, this tool is for early assessment. This tool is for early assessment of asymptomatic atherosclerosis, provided prognostic information in asymptomatic population. So what is this telling you? This is telling you is this test can be done with no symptoms, asymptomatic, and this will give you information on is there any potential for you developing any cardiovascular problems in the future. Now remember, Now, if you have calcification in your artery, there's probably other places in your body that you have calcification. So if I have a little speck in my heart, maybe I have a little speck in my brain right now. So this is concerning, right? So it's only 0.3, but yet it's there. I'm not at 0. So, I'm just going to monitor this, and I have a baseline now. Here's another research study down in here. No, before we get to that, this is a really, really significant study. So what this is telling you, so this is the CAC score right here. So you see the CAC score is 0 to 90, and this is the CAC score is 100 to 2500. Now, if you come back and you have a score of 100, that means that your arteries are in condition of a 73-year-old man. So this can actually predict the future. If it comes back at 500, you're an 84-year-old person when it comes to the heart. So the one that I showed you that was 2006, right? He was a 40-year-old man. So this is very significant. So he's a 40-year-old man, but he has a score of 1206. So, he has a heart condition of a 90-year-old. So this can kind of give you an idea and give you basically a comparison of what's healthy and what's not healthy, right? So here's another study right here. It's showing that the CAC score is an independent marker of risk for cardiovascular events, cardiac mortality, and all-cause mortality. So this is just a good diagnostic test to really tell you how far, how your heart's in, how your cardiovascular system is in. So basically, it's $99. You just literally go to a local scanning place, call them up, tell them that you want this scan done. My places didn't even work with insurance here in Minnesota. So I hope this found this value in you. And remember, is where there's help, there's hope. Take care. Bye-bye.